So today I'm going to be talking about two cases for my case connections, and the first is case 2. Case 2 states a 4-day-old infant, patient A, is being followed in your clinic. Her birth weight was 5.9 pounds and the pregnancy and birth, which was vaginal delivery, were normal. Results from the newborn screening demonstrated a phenylalanine level of 6.6 mg per dl. A presumptive diagnosis of phenylketonuria were made and additional samples were obtained for further analysis. The parents deny a family history of PKU. As a consequence of this presentation, which amino acid may become essential? Phenylalanine dietary restriction therapy was initiated at 14 days of age with good response of plasma phenylalanine levels that dropped within the normal range. What are the potential causes of the presentation of phenylketonuria? Another infant, patient B, is also being evaluated for suspected PKU. BH4 loading tests are performed on both patients and the results are presented. BH4 loading tests consist of tablets of synthetic cofactors being dissolved in 20 milliliters of water in dim light and administered to the patients at least 30 minutes before a meal. Blood was drawn, and 4 to 8 hours after BH4 loading, they were drawn again. Phenylalanine levels are determined. How would you summarize the results of this test for patient A and patient B? When reading about this case, I first wanted to know more about phenylketonuria, or otherwise known as PKU. I found that according to the U.S. National Library of Medicine, PKU is caused when there is an increased level of phenylalanine in the blood and can lead to serious issues in the body. I then looked at how the infant was presented to the clinic. Everything seemed normal on the outside until they did a newborn screening and saw that the infant's phenylalanine levels were very high compared to the normal levels of infants. Some good background information to know from Chapter 9 would be to know that the phenylalanine hydroxylase is needed in order to turn phenylalanine to tyrosine, and when there is a defect, then there is an increase in the amount of phenylalanine in the body, but tyrosine will not be able to be produced, causing it to become essential. This is important to know because according to Chapter 29, this is what causes phenylketonuria to occur and is seen in infants, especially around the 3 to 4 day mark, and in this case, patient A was 4 days old. After patient A was diagnosed with PKU, a dietary therapy was started once the infant was 14 days old, which caused the phenylalanine levels to drop to within normal levels. As mentioned earlier, when there is a defect in phenylalanine hydroxylase, this leads to PKU. It is also important to know that phenylalanine is mainly found in protein-rich foods, so one of the causes of why this infant has PKU could be due to the amount of protein it is receiving. Another cause of why this infant could have PKU is that the mother had PKU and the infant has now inherited this disorder as stated by the U.S. National Library of Medicine. Some of the symptoms stated by the U.S. National Library of Medicine include possibly having intellectual disabilities, and in order to combat this, Chapter 9 states that having a diet low in phenylalanine can prevent mental retardation. Having a diet low in phenylalanine would mean eating less protein for the infant as mentioned earlier. As you can see very clearly, patient A and patient B have very different results for the BH4 loading test. Patient A's levels for phenylalanine are seen steadily increasing, while patient B's phenylalanine levels are seen drastically decreasing. In patient A, the levels of phenylalanine are seen to be increasing, and this is because patient A is not able to turn phenylalanine to tyrosine, causing there to be large amounts of phenylalanine. On the other hand, patient B's levels of phenylalanine are decreased because tyrosine is most likely being able to be produced, causing the phenylalanine levels to drop down to normal levels. Since the levels are dropping down to normal levels, patient B will most likely not be diagnosed with PKU. The second case I'm going to talk about is case 3, and that is a 47-year-old man presents with severe pain in his right great toe. He is unable to bear weight on his right foot and there was no apparent trauma. He reports the pain started last night and continued to increase in severity. Based on this physical exam and laboratory findings, he is diagnosed with gout. Gout can be caused by several different mechanisms, and blood samples are drawn and urinalysis is performed. The results from this individual are listed. What is the best explanation for the presentation of gout in this individual, and please explain why the other choices are not consistent with the data or what additional information you may need to decide the root cause. So the 3 choices are 1. Overproduction of purines, 2. Decreased salvage of purines, and 3. Decreased urinary excretion of uric acid. After further discussion with the patient, he tells you that he recently switched from diet soda to regular soda because he read that the fake sugar diet soda was bad for him. He tells you he drinks between 4 and 5 liters of soda a day. What is the potential impact of this dietary modification on the presentation of gout? So when looking at this problem, it is important to remember that gout is a form of arthritis and occurs when there is too much uric acid flowing throughout the bloodstream. When looking at the data that was presented, you can see that the plasma urate levels were high and the urinary uric acid levels were much lower than the normal levels. This means that somewhere along the lines of when uric acid is being released from the body, the 47-year-old man is having difficulties. This might have to do with his diet and how he recently switched from drinking diet soda with fake sugar to drinking regular soda. As mentioned in the problem, regular soda is mainly made up of fructose or high fructose corn syrup, and as we have learned previously, fructose will later be turned into a purine. When the 47-year-old man is drinking this fake sugar, this could mean that the proper amount of purine is not being produced, which in turn will not produce uric acid or as much and will in turn cause more issues in the body with how the body should be excreting uric acid. Within the body, the 47-year-old man can also have a genetic defect in PRPP, which is called phosphoribosyl pyrophosphate, and can cause gout. Later on, this can lead to an overproduction of purine, so option 1 could be a cause as to why this man has gout. When there is an overproduction of purines, these purines will be oxidized to form uric acid, as stated in chapter 33. The way that uric acid will get out of the body is going to be through urinating, which will lead to the next function that may not be working, and that is that the man may be experiencing a decreased urinary excretion of uric acid. Looking back at the results given in the table, the amount of urinary uric acid is much lower than the normal level that should be excreted, so this obviously means that the man is not excreting the proper amount, which would result in option 3 of decreased urinary excretion of uric acid to be true. The man could be going to the bathroom normally, but just not excreting the uric acid. Not only is his lifestyle and blood results affecting the diagnosis, there is also the idea that gout usually targets certain audiences over others. According to the U.S. National Library of Medicine, National Institute of Health, they state that men in Western countries usually get gout 3 to 6%, while women only show 1 to 2% of getting it, and this usually rises as either sex gets older. With the patient being 47 and male, this could further prove why this is true. The man also complained of feeling severe pain in his right toe and not being able to bear weight on his right foot. These symptoms are mainly being shown in the joints, which are most likely inflamed. This could be related back to how he is not excreting enough uric acid, causing his urate levels to increase, which will in turn cause crystallization in his soft tissues and joints as mentioned in chapter 33. This is why he is experiencing pain, because he could also be experiencing another form of gout called gouty arthritis.